Good morning. This is the Bond Report. I'm Dr. William Bond. Today's Bond Report is 3 case studies that we're going to present. I'll apologize in advance with a brief anatomy lesson. My father sent me to college and med school. He had not gone himself, and I'm fishing with him and some of his World War II buddies, and they're getting a big laugh out of the fact normally they'd fillet the bass rather than go to the trouble of clean them all the way. And he can do that quite a bit faster than I can. So here I am, college boy and the big surgeon. And, gee, I can do this faster than you can. I spend all this money. You're a surgeon now. And finally, this didn't look like it was going to die out as soon as I thought it should. So I said, well, show me how you do it. There's a bass fillet. I'll watch you do that once. So he does it. And he was fast at that. He said, well, what do you do? And I said, you're going to be a surgeon now, put it back together. And that was the end of that. That was the end of that then. It was the end of that with those other guys, and I never brought it up again. Today is going to involve a little bit of anatomy. People think of themselves as these chocolate Easter bunnies. That's either filled with air or it's solid chocolate all the way through, and you're not anything, and you're filled with other things. One of my sons has asked me, gee, what's it look like in there? Well, basically you run over a squirrel on the road. That's what you like. That's what you look like. I said, that's what we all look. That's what I look like. That's what we all look like. Basically, people are made out of salt water and roadkill. If you wanted, this was a coinage I liked. I've had a request to not do that. We're going to sing anyway, and we're going to do that. As Voltaire said, the art of medicine is murderous and conjectural. You learn by, as Sir William Osler said, you learn by doing. Medicine is not learned out of a book. It's not learned in labs. It's learned at the patient bedside. It's learned by the observation and working with patients. And once you've done that, that case probably isn't as typical as you think it might be. You need to do a lot of cases. So you think you're hardy and experienced after one case or two. A lot of the time you're not. We begin, everything in medicine, people say, well, gee, how do you keep it straight? Is it your left? Is it? In medicine, always they start this the first day. It's the patient's left. It's the patient's right. It's on top of the patient. All orientations and directional things are the patient. So this person in this particular MRI is looking at you. We didn't have MRIs when I was a resident, but here is the dark area there is called the maxillary sinus. It's below your orbit that has the eye in it, obviously. And you see on the patient's left there that some tissue is hanging down. You also see the bone is thinner at the bottom. This is characteristic of the anatomy of the orbit. It's thicker bone at the top. Your brain's up there, among other things. And the thinner bone is over the maxillary sinus. And it's in about the nose, what's called the lamina papirici, and not important. Now we're going to illustrate a case. I've changed the names to protect the probably not so innocent. This is Leonard Smith, and he's in there, and probably if you're meeting him, he'd say to you, you'd ask him a question, he'd say, who me, as we've covered in previous talks. This is some of the anatomy of the eye. There are 6 muscles, or the anatomy outside the eye. There's 6 muscles, 4 rectus, left, right, top and bottom. And there are 2 obliques, superior and inferior, and these turn the eye diagonally and also spin it. So it can be done with that. These are an illustration of the movements. You have a more detailed one, you'll have more of an anatomy thing when you've got some interference with movements. But there it is in the orbit, and that's pretty much the way it looks. In fact, those muscles look like the real ones do. When you're struck with a baseball, a fist, something that won't get through the orbit. Mostly, it's protected because your fist is bigger than that orbit. And so it hits the bones, it imparts some shock, and the shock goes back in. If there's enough shock, it starts to break these little bones. And that's nothing in itself. If you leave it in place, they'll heal and do some things. But a lot of the time, you'll get what's called a blowout fracture. And what happens, so what you saw in that previous study, was that some of those muscles, typically the inferior rectus on the bottom, will start hanging down into the orbit. And the worry is that it's going to get caught, and then the eye movements won't be symmetrical, and people see double and this and that. and it can be permanent if you don't fix it. There's some various ways to fix it that have to be done, and this is controversial. The timing changes. The leading cause of retinal detachment from sports is hockey, which is extremely unsurprising. But the second one, interestingly, is tennis. And tennis is because so many Packers play that, and you've got a lot of people, say you're playing mixed doubles, that wouldn't dream of throwing a baseball at your wife's head or do anything like that, but they think nothing of two-handed and trying to slam a tennis ball at her, which will do that. But also, if you're playing doubles, the side of a racket won't hit that bone. If you got it in the right way, it'll go as far as it goes. It's not hitting the bones. And you can get a pretty wicked eye injury with the edge of a tennis racket. When Angola was the Louisiana State Prison when I was a resident, and LSU, we saw those patients from Angola, prisoners, whatnot, and those guys carried sawed-off pool cues, or the trustees would carry sawed-off pool cues. They would have them do that, and a pool cue is a lot worse than a ball bat for that reason, though the bone will stop it. So here's a blowout fracture. Now this person, I can't tell sex, has got their maxillary sinus filled with that tissue. You can see the eyeballs there. In fact, there's a good demonstration of those rectus muscles and an oblique on that left side, and you can see these muscles coming up to the eyeballs. These are planar views. It's as if you had a blade coming down. You're seeing this at different levels. You'll watch it expand and contract as you move there, depending on exactly where the vertical thing is. And you can see those muscles coming up to the eye on the left. In the right, the patient's right, you see where that muscle typically has gone down into that maxillary sinus, and that's going to start impeding the movement of that eye. Well, do you have to fix that? And this is the garden variety fist that won't go in the eye. Now, the preponderance of blowout fractures is left, and they thought for a while that was an anatomic thing with women, and what that is the preponderance of right-handedness in the population. It's somewhere between 89 and 91% of people are right-handed, and most heroes that hit women are right-handed, and most men, this is another charity, most men hold left, hit right, and so the average victim will get that in the left depending on whether their loved one is a lefty or not. Typically, that's just not an anatomic thing, but a sociological thing, if you will. But, the average hero is the same as the population. His chance of being right-handed is 89% or whatever it is. And now that inferior rectus is going to slide down into that or go through that hole. In the bone, it'll be caught down there in the maxillary sinus. It doesn't always smooth back out. So you can see that blowout going in this diagram. That's, the maxillary sinus is a lot bigger than that, as you've just seen, but it'll slide down there and do this stuff. Now, the old-fashioned test, which is what I'm getting to in this, is this test. I'm going to digress a little. Charity Hospital, we did not have individual rooms or even roommate things. We had wards. We had between 20 and 35 people in a ward. They were all right there together, the men and the women. And the classic test for the ruling out a blowout fracture, if you will, you've got someone where the eye movement is compromised up and down. Is this from a blowout fracture with a tissue being caught? The movement of one eye is technically called a duction, D-U-C-T-I-O-N. That's one eye movement, that's adduction. The movement of both eyes together is called a vergence, V-E-R-G-E-N-C-E. That's a vergence. And so the idea to prove this absolutely is called a forced duction. And what you have here is you put a little anesthetic on there, and you grip, typically it's the inferior rectus, that's the problem, and you grip the superior rectus and see if there's an impediment to the eye movement. That can be done. That can hurt quite a bit if you do it wrong, so don't do it wrong. And that's a forced duction. That's how in the old days how you prove that. Now, you're in there making rounds at about 6:30. A very good friend of mine, Bob Fabricant, was a fellow resident with me, and he's talking to the people, to the guy in the bed next to mine, who was Leonard Smith, that you saw already. And he's down in there, and Leonard's got a blowout, and we're going to do forced ductions on him upstairs. And he's kind of looking at Bob like this. I've got my back turned to them, and I'm doing my stuff with my own patient as you're making rounds. And Bob is talking, you can hear this, and he's saying to the patient, well, Leonard, you understand what we're going to do? And Leonard said, I'm not sure I do. What my understanding of this is that they want to take me upstairs and make me a little sleepy and do forced seduction on me. S-E-E, we know how to spell it, but we want to do forced seduction on me. And I've got my back to this, and I'll tell you what I did. You're not ready for that at 6:30 in the morning, is I set my chart down and just as fast as I could walked with, I hope, the proper amount of dignity out to the hallway and just lean up against a wall and laugh. Come on, for seduction, 6:30 in the morning. Hey, that's funny. It doesn't, The other thing you wanted to do in those cases is do a thing called an orbital bruit. A bruit is a noise. There's a carotid bruit for the main thing here, and that means your thing is narrowing, and the blood with the heartbeat is making noise. And you'll hear that. If you've got a blowout, if you've got an orbital bruit, I had this in a girl was a student nurse, and she had tried to kill herself, and she'd taken a 9mm pistol into a New Orleans phone booth, and she'd put that thing on the side of her head and let herself have it. And she'd gotten a carotid bruit after that. Now, this thing skated around on the inside of her head. They do odd things, bullets do. They'll follow bones. They'll do some different things. And she had woken up in a pool of blood in this thing. She's not in heaven. She's not in hell. She's right there in New Orleans in the bottom of a phone booth with her blood around her. And so she decides, like most of them don't, she's going to kill herself. So she puts this thing on her sternum and shoots herself again, right through the chest. And I couldn't do this in an hour and a half with like a wire if I was trying to do it. She misses the heart, misses her aorta, misses her great vessels. It'd take me an hour to do that, and it would be the trickiest thing in the world. She can do it just like that, bam. And she was unconscious that time. They brought her in as a Jane Doe and went up to psychiatry, and they straightened her out. And she became a contributing member of society. Longer story, but you're listening for a bruit there, because you'll get the occasional patient, what the hell are you listening for? Well, you're listening for a couple of things, but the main thing is you don't do a biopsy of that. The common ones for that are trauma, but there's a disease called von Recklinghausen's, which is not rare. It's about 60 people in 100,000. You've got 100,000 people, there's 60 of them will have this, and they'll have a congenital absence of the roof of the orbit. And it doesn't hurt the brain is up here, and it's got its own blood supply, and the brain will kind of slop down into that orbit, and it's fine. It's anatomically correct, it's firing, it's got all of its blood supply, but it's okay. Now, the thing is, let's biopsy that and see if there's anything funny in that orbit. Well, your biopsy, the other one, what she had was called a CC fistula, carotid cavernous fistula, where the vessels have been injured and they start going together, the carotid artery and what's called the cavernous sinus, which is the big vein there that drains it. And so the blood will get going backwards, but also it'll make that noise. So if you do a biopsy and cut that blood's going to go up about 2 feet in the air, and that patient's probably going to exsanguinate before you fix them. Or they've got neurofibromatosis or von Recklinghausen's, and that their brain's done, and then you biopsy that, and it's going to come back normal brain. That's not what you want. And so typically you're looking for that bruit. This is one of the more evil diagnoses that you get, or evil physical findings, and that this diagnosis is a real murderer's row here, but that's a differential diagnosis where you're supposed to be thinking about. So bottom line, don't do that. Blowout fracture, forced seduction. That's one of those things, like listening to Dean Martin sing that some more. I cannot think about that story and not smile a little, and it doesn't matter. Our next case study, that's case study number 1, Johnny Matson. Now, Johnny Matson, this is not his MRI. They didn't exist when I was a resident. But here's a guy with what Johnny Matson had, this kid. And this is what's called an orbital apex syndrome. You can look down on the one that's on your right and see that there's something at the base of that orbit, base meaning as you go all the way in. Now, people are made so that there's not much that goes into the orbit that doesn't go in through the back end. They're kind of cone-shaped. and they get kind of narrow. As you see in that blowout, it bounces off that and breaks the bone. This is something's happened in that orbital apex. It's at the back, and it's narrow, and it expands outward. It's like you have a cone in there. Now, this guy was hard to kill. I have somewhere a copy, owns with his medical records in New Orleans. I've got a copy of his chest x-ray that they did for me, and this was very tame. It's got some shotgun pellets in there. This guy had 7 or 8 bullets, fragments, that you could count in there of different calibers. He had blades in there, presumably a knife blade, that were left in there. He had shotgun pellets, pieces of that, and distinct bullets. He was in Charity Hospital for his 7th or 8th episode of gunshot. And this doesn't mean that they had, that he was in there for getting shot 7 times. Most people will empty the gun when they're in genuine fights or things. Cops will tell you that. But most people will empty it. And this guy, this was his 7th episode. In the last episode, when I'm his doctor, he'd had 2 in the chest and 2 in the face, close range. And here he is talking to me, eating his breakfast. Sum it up one phrase, this gentleman was hard to kill. And so our pathologist wants to demonstrate an orbital apex syndrome to a grand rounds. They typically fail. We did those at the LSUI Center. Typically, Charity Hospital, you tried to organize transportation. They utterly typically screw that up. So here I am in my old beater car, and I got Gatson in my front seat. And he's got the towel wrapped around him. Charity Hospital, he's got a toothpick in his mouth. And we're riding down there to grand rounds. Now, the orbital appearance can vary a lot depending on how these things look. There's an orbital apex. And you can get fooled on this. You know, the involved anatomy, the individual anatomy makes these things change. But you can see here, for instance, that patient's left eye's move when the other one's not. Orbital apex will take a lot of forms. But picture the skull. A lot of bullets, when they're starting to lose some steam particularly, will kind of be guided by bones into different things. It can be seen, the orbit, the open part of the cone is out there, and it's thicker along your brain, along the superior end. So it'll miss that, but it'll go down that bone, but you're channeling that bullet, so it's going to hit all the stuff that's in the back of that orbit, which is everything coming into the orbit. So you get the optic nerve and all the muscles that make the eye move all at once, those nerves. And there's a guy, he's looking out, there's the right eye, but there's all those structures, and you can canalize a bullet right into that, and then there's various things. This is called an orbital apex syndrome. You can see the bone there is thicker along the top for most of its thing. This is just the way people are made. So here I am. So this is called orbital apex syndrome. So Johnny Matson and I, he's in the front seat of my car, this guy that's hard to kill, and we're chatting. And I say to him, he's in the front seat of my car, say, Johnny, what so-and-so? Who, me? That's Charity Hospital. And I just kind of idly chatting, I say to him, how come you get shot all the time? Well, I never thought about it. You know, it seems to happen a lot. Yeah. You in a dangerous line of work or something? He said, oh, I don't know. What do you do? Well, I'm here and there. Well, how come you get shot all the time? Well, I guess folks just don't like to take no chances. That's as far as I got and as far as I expected to get. Some things are simple, like this. That is the entire instructions for that video game. Insert the quarter, kill Klingons. Some things are simple, and some things are simple like Randall Tech's cut. You know, you make a mistake in tennis, it's 15 love. You make a mistake in baseball, it's strike one. You make a mistake in boxing, he was a boxer, you're on your ass. Third case. This was nice people. And this is a nice mother, got her hair pulled back, about late 20s, early 30s. And she's bringing 2 of her 8 kids in there, and they've had this wild conjunctivitis. They like to swim. And they're in there for this. There's a pretty typical case. And this is coming out of typically chlorine in pools of swimmer's ear and things like that. And, you know, it's irritated and it's this. Why do they have chlorine in swimming pools? Why this, that? And she's got 2 kids, and their ages, I'm trying to remember. I've got them here. Yeah, these aren't them, but this is the ages. This is what they look like. This is not the child abuse scenario at all. These kids are well-nourished, well-fixated, paying attention, and they have got this horrible-looking thing, like those insects. These aren't them, that build like those things that look like brown tents in trees. She's coming in now. She's been going to a local eye doctor up at some mall somewhere, and they've been, doing drops, and they've been doing this, and this thing gets worse every day, these things. And what happens is they're sitting screwing with that, not knowing that not everything's conjunctivitis. And these guys are, they're sensitive around their eyes. They do these other things. I just put that in there about kids. These are very well-mannered kids. The hardest thing, said Fred Astaire, about learning good manners for kids is they've never seen any. That wasn't the case with these kids. They were very polite, nice, and they've got this awful looking thing around there where something's been going on. They've been going to the doctor. Their mom's been seeing them. They're very obviously don't fit the usual abused child syndrome. They don't look underfed. They don't look anything. They're obedient. Now, but the thing is, when you go, here's Goldfinger talking to James Bond. Once he said he'd had some things. Once Mr. Bond is happenstance. And two times is coincidence, but 3 times. Mr. Bond, 3 times enemy action. They've been fooling with this for well over 3 weeks. It started like this, and now it's going to this. When you look at that, as you go to this and these horrible swollen things, and these nice looking clean little kids, she's in there asking you what that is. That is pubic lice. The regular lice that are in kids' hair don't like the eyelids as much, but the pubic lice, the crabs, the ones that are in your genitals, they think they've died and gone to heaven. The skin is thinner. The lashes are a little bit of the curl, and they think evidently they're pubic hairs. You can't really interview them, but they thrive on this. Then they start to lay their hateful little eggs along in there, but these are the crabs, pubic lice up in your eyelids. And this is not as rare as you might think. And the cure for this is you get a little bit of alcohol right by you, and you try to get Dragoon, your girls, into sitting and helping you, doing this and that. And the adults will have their heads buried in there. And the line, you got to get every line, you got to pull these out. They're kind of stuck to the lashes with slimy crap. And you got to take some forceps and pull this out. And I remember these kids, I'm thinking this is going to be a joy with these little kids. These kids sat there as I did this with a slit lamp, which is our instrument that we use. And I pulled those things out, and they were easy. And my girls are this, and you're kind of that way yourself. You don't want one of these things on you. You dip them in the alcohol right away, which kills them. But you're pulling the slimy crap off of this. This is a mild one. These kids look more like this. This is when they've been functioning for a while, and they looked like this or worse. It was awful. And they're not doing it justice with what we have on the slide here. It was more around the skin. So you pull these things out. I still remember my actually kind of tough-minded girls just like this. Gee, you feel crabby, you feel lousy, all this funniness. So I'm doing this, and Mom's sitting here saying, well, what are this? And I said, your pubic lice. Well, how's that possible? I was in a branch office, and they happened to have a microscope outside. And so I pulled one of these things out, dipped it in the alcohol, put that on a microscope slide, and focused that, and you see like one of the, louse in a natural history book. And I say to Mom, look at that eyepiece, tell me what you see. Well, gee, she's just appalled with this. She's asking me, well, how could that happen? I'm thinking, I don't know, sis. I'm just the doctor, but I tell you what, I'm not the one who's got to start getting their story straight, because I am violating the family services, as I'm obliged to do by law, but I would do enthusiastically. And I'm not the one that's going to be working on their story. This is what's going on in your head, but you don't say this. And I didn't know how that happened early on. But this is typically what happens, because the first thing I said, because this wasn't the child abuse or weird thing, with Charity Hospital, it wasn't any kind of weird thing. This was up here when I'm in practice. And the common cause up here is swimming pools without enough chlorine. And so I say to this nice lady, I say, have you been in any swimming pools? Yes. Yes, I have. I remember the way she got the look. My husband, and she never said the word without this inflection after that, my husband. and I took the kids to Disneyland about 6 weeks ago. And my husband said he was tired and wanted to sleep. And we were at some little awful place in Tennessee or Kentucky, somewhere like that. And we got there and the kids wanted to swim. I didn't like the way this motel looked. I didn't like the way that swimming pool looked. It looked and I didn't want to. And my husband said to me, well, why don't you loosen up a little and let the kids swim? So I did that. And it was going to be tough when he got home. I did, in fact, by law, you violate him to family services. He got the same thing I did. This was nothing. But I guess this lady became legendary among the neighbors. There's this Quill shampoo you get that's an anti-louse thing. And she goes down to wherever you get this stuff in and brings it home in buckets. I mean, she's washing the walls of the house with it, like you'd paint a wall with rollers. She's dipping the dog in there, like I guess they dip sheep in cartoons. This was just unacceptable. And, I've had a little inward smile. And there he is. That's the pubic louse, teres pubis. And swimming pools need to be bright blue. I would say this sometimes. You do see this occasionally in practice. And people would come in saying, boy, I wish they'd get less chlorine in pools. And if I had the time, I would say to them, I'm going to tell you a little story. It won't be as long as I just told it. I'm going to tell you a little story, and you won't think there's enough chlorine in the world and I'll be right. It always happens. Now, there's one starting out, that little booger down there about 2 inches in. That's a louse. He's got his head buried in there, and you pull him out, he'll wiggle his little legs if you didn't kill him, pulling him out. And the treatment is right there. Poison gas, but be sure, if that thing is not chlorinated, don't go in there. Some things are simple. The Pakistani jet that flew over the hillside might have been flying too low. Patient Hendricks, but some are a little offbeat. Patient Hendricks calls, reports purple haze. So what could that be? That's a raft of things. And some things are not simple. Some things are not simple. You're under fire. Well, gee, why don't you speak a little louder? Sometimes you find things you don't expect. You need to do some workup on these things. This is a true case that happened in the last year or 18 months. They've got a cold case from a 1970 thing. Gee, let's look for this car for evidentiary value. And so we're going to dredge the Chicago River looking for this car. They find 97. Presumably one of them had that. I remember this being in the paper, and I thought, well, that's a lot of evidence, Ready knowledge you got to have, People find it disturbing, but you got to have those funny diagnoses. This might be something congenital where there's not a roof of the orbit, and you got a little slump of the lobe of the brain in there that's doing fine. The art of medicine really is murderous and conjectural. As Voltaire correctly pointed out, your education never ends, says Sherlock Holmes. Life's a series of lessons with the greatest for the last. I'm not looking forward to learning the last one much, but I remember this could be a lot of residents walking out of a grand rounds and the guys trying to, what did we learn today? One last charity hospital story. This one's a little more uplifting. I had a patient, and his dark brown card, charity hospital card, said, Johnny No Middle Name Nash. And he actually had gone by that a few times. And we called him that, Johnny No Middle Name Nash, the time he was in there. They found him unconscious in the street. He'd had a previous time when he was found unconscious, like 3 or 4 years ago, and he'd had a leg that evidently he'd been hit by a car again. He was unconscious in the street this time. And the leg had not healed properly. It was a short link, and it's very easy to say, the old-time guys from saying elsewhere, oh, they didn't do this properly with medicine. But I'll tell you what, when you've been all the king's horses and all the king's men, sometimes there's not all the Humpty Dumpty to put together again. That doesn't mean somebody got bad medical care. That means they got something where that's still laying out there in the street, or it's gone, or it was just smashed beyond recognition, and you're lucky to get that. Well, anyway, it was Johnny No Middle Name Nash came in there. He was a John Doe. He had his charity hospital card on him, and he wound up in our service because he had a wild glaucoma. He'd lost one of his eyes in the past, and it was over, I'm going to say like December 20th, 21st of my third year of being a resident. And he had this crutch. that he'd walk on, those old-fashioned ones that you see around, like some real old-fashioned one. He had kind of this rolling way that he'd walk. And so Johnny No Middle Name Nash, and it's over Christmas. And you're trying not to be like this, but he reminds you of Tiny Tim. He's got his crutch, and he'd walk. You'd see him walk to the bathroom or do some various things. Now, he had this wild glaucoma, and I wound up managing that. We got some good care on that. And I had to operate on him in what turned out to be Christmas Day that year. So, you're following these people. You're seeing them twice a day. You're staying around there. This was an old-time thing, and he was having a crisis. He had the eye injured also. And I wound up operating on him on Christmas Day itself. And it was a big success. And everybody was happy. He stayed in there several more days. And you don't think more about it. This is a routine thing. He goes back to wherever his home is. He oversaw orange groves on this one because I asked him about that because I wanted to make sure he got his drops and he did his proper care. Well, he was going to manage these orange groves. He had a job lined up in wherever they grow oranges in Louisiana, which I would, but that's where he had a job. Everything goes on, and then I go out. I'm in practice in Illinois, and I come back, for some reason, I'm going up my steps on December 23rd or Christmas Eve itself, and there's this big crate on the front step of my office. And I look in this thing, and on this crate, Johnny Cash had written on lined paper about, he sent me a crate of oranges. I have no idea how he got my address or did anything. This is before the internet and any of that stuff, and it was some effort to look people up. And he'd sent me this crate of oranges, and on this lined paper, he'd written in his surprisingly nice school kid handwriting, "I hope you and your wife enjoy these." And he'd written out at length ways to prepare these oranges and do this and do that. And this was such a bag of little money. It was a pretty big thing. And he'd gone to a lot of trouble with that. And the closing of that was, "Thank you again so much for all your expertise, for all your help and niceness. I'm thinking of you this Christmas as I will every Christmas. And thank you for giving me back my eyesight. I hope your wife and you enjoy this very much. You're a good friend and patient, Johnny No Middle Name Nash." And so I'd like to end that on what I thought was a higher note. And thank you very much. Please watch Bond Reports. Thank you.